into effect, I think it actually just went into effect. All patients on long-term opioid therapy must also have the emergency overdose rescue kits assigned to them. They feature naloxone. It's a drug that, according to a paper by Edward and Reed, naloxone can rapidly reverse the effects of opioid overdose, and it's the standard treatment by paramedics or first responders when they come to a suspected overdose. And since many chronic opioid patients don't know the severity of the risk they face from taking them chronically, the law could help save lives by bringing awareness and by giving their loved ones a way to quickly reverse overdose if they find that it's happened. Another thing that's been on the books for a while to try to help with the drug problem, prescription monitoring programs that are implemented at the state level. They've been around for a few years, and there's, according to a study by Davis, Johnson, and Pierce that analyzed the language and the laws that established them to see what the stated purposes were, almost all of them mentioned reducing the prescription opioid supply on the streets, but only a few mention overdose prevention, even though this is obviously a tool that could go a long way towards that. They suggest that changing the language in the laws and on the websites could help the tools be more effective at stopping overdoses. Another thing that I think should change is the enforcement of the laws that are currently on the books that are designed to keep prescribers from maintaining narcotic addicts. A pharmacist I work with who's worked as a pharmacist in Oklahoma for over 50 years now related to me a story about a time when he was, a few decades ago, when he was a young pharmacist, and some people from the State Board of Medicine came into his pharmacy and told him, hey, you need to tell Dr. So-and-so next door, stop prescribing methadone to this patient. It wasn't methadone, what was it? I don't remember. But yeah, you need to cut her off right now because it is illegal to maintain an addict. And so when he asked, why do I have to do it? Why can't you do it? It's your job. They replied, well, if we do it, we'll have to revoke his license, and that'll be the end of his career. His family will be, without a provider. So, the story highlights that doctors are regulated first and foremost by a board of their peers who are very sympathetic to their plight and might be reluctant to bring disciplinary action to them. And then when I was looking over the DEA website, they almost never revoke someone's license before the state board has already acted. Every case I looked at, they revoked it after they had lost their license to practice in the state. So, it's really up to this board of their peers to take action against them, and they're reluctant to do that because it would ruin their career. So there are a lot of doctors out there that maybe shouldn't be prescribing. I was really reluctant to give this speech because I didn't want to step on any toes, but considering the gravity of the situation, especially with the risk of death involved, I felt like I needed to say something. Painkillers are very important and have a very well-defined place, especially after a surgery and for chronic cancer patients, but we need to keep in mind that they are also dangerous, and maybe long-term use isn't the best way. Wanted everyone to realize that the power and danger contained in those little white pills is quite a bit, and it could end your life if you're not careful. All right. Thank you for listening to my speech.